I have been waking up at night, by my jaw snapping shut, some of the time on my tongue making it bleed and the rest of the time tooth to tooth. In the morning my jaw will be sore and my teeth will hurt. Can you help?
Hello and welcome to Just Answer. Well, I hate to be the bearer of bad news, but one thing about it, I can tell you what is wrong. My sister is a dentist and I have worked with her on and off for years. I have the same condition you do. It is called TMJ or temporomandibular joint disease. Temporomandibular disorders, TMD, occur as a result of problems with the jaw joint and surrounding facial muscles that control chewing and moving the jaw. This disorder can cause all kinds of things. It will make your neck hurt constantly, your ears hurt, your jaw hurt, it can go all the way down into your back. This disorder can cause problems from your head all the way down to your feet. Clenching your teeth at night can cause tremendous amount of pressure, which affects many things. It also causes depression as well as fatigue, because you are constantly using those jaw and neck muscles. It totally will wear you out. The temporomandibular joint is the hinge joint that connects the lower jaw to the bone which is immediately in front of the ear on each side of your head. The joints are flexible, which allows the jaw to move smoothly up and down and side to side and enabling you to talk, chew, and yawn. Muscles attached to and surrounding the jaw joint control the position and movement of the jaw. The cause of TMD is not clear, but dentists believe that symptoms arise from problems with the muscles of the jaw or with the parts of the joint itself. It is big controversy in the dental world on what really causes it. I believe a lot of times it has to do with the misalignment of the teeth. Injury to the jaw, temporomandibular joint, or muscles of the head and neck, such as from a heavy blow or whiplash, can cause TMD. Other possible causes include 1. Grinding or clenching the teeth, which puts a lot of pressure on the TMJ. 2. Dislocation of the soft cushion or disc between the ball and socket. 3. Presence of osteoarthritis or rheumatoid arthritis in the TMJ. 4. Stress, which can cause a person to tighten facial and jaw muscles or clench the teeth. People with TMD can experience severe pain and discomfort that can be temporary or last for many years. More women than men experience TMD, and TMD is seen most commonly in people between the ages of 20 and 40. Common symptoms of TMD include 1. Pain or tenderness in the face, jaw joint area, neck and shoulders, and in or around the ear when you chew, speak or open your mouth wide. 2. Limited ability to open the mouth very wide. 3. Jaws that get stuck or lock in the open or closed mouth position. 4. Clicking, popping, or grating sounds in the jaw joint when opening or closing the mouth, which may or may not be accompanied by pain. 5. A tired feeling in the face. 6. Difficulty chewing or a sudden uncomfortable bite, as if the upper and lower teeth are not fitting together properly. 7. Swelling on the side of the face. Other common symptoms include toothaches, headaches, neck aches, dizziness, and earaches and hearing. Seems to me you have a lot of these symptoms going on. You really need to go and see a dentist first to be diagnosed, and she can prescribe some muscle relaxers at night for you, which works wonderfully. Also, they can make a night splint for you to wear that will perfectly fit your teeth, and you will be amazed how much better you will feel. I must tell you though, the splint is rather expensive. It costs anywhere from $250 to $500. But it is worth every penny. There is a lab that my sister uses that invented the soft splint. It is called Space Maintainers. Instead of the splint being really hard, you run it under warm water before you put it in at night, and it forms to your teeth and is very comfortable. They also correct the bite by positioning the teeth in their most correct and least traumatic position. The main difference between splints and night guards is that night guards are only worn at night and splints are worn full time, 24 hours a day for 7 days. Your dentist will discuss with you what type of mouth guard appliance you may need. Sometimes panoramic X-rays will be taken. These full-face X-rays allow your dentist to view the entire jaws, TMJ, and teeth to make sure other problems aren't causing the symptoms. Sometimes other imaging tests, such as magnetic resonance imaging, MRI, or a computer tomography, CT, are needed. The MRI views the soft tissue such as the TMJ disc to see if it is in the proper position as the jaw moves. A CT scan helps view the bony detail of the joint. Your dentist may decide to send you to an oral surgeon, also called an oral and maxillofacial surgeon, for further care and treatment. This oral healthcare professional specializes in surgical procedures in and about the entire face, mouth and jaw area. I would only try this at a last resort. Your dentist can't continually prescribe muscle relaxers, but you can see your doctor and your doctor can prescribe them indefinitely as long as you need them. There are some muscle relaxers that are non-sedating, such as scalaxin. Treatments range from simple self-care practices and conservative treatments to injections and surgery. Most experts agree that treatment should begin with conservative, non-surgical therapies first, with surgery left as the last resort. Many of the treatments listed below often work best when used in combination. Basic treatments: apply moist heat or cold packs. Apply an ice pack to the side of your face and temple area for about 10 minutes. Do a few simple stretching exercises for your jaw, as instructed by your dentist or physical therapist. After exercising, apply a warm towel or washcloth to the side of your face for about 5 minutes. Perform this routine a few times each day. Eat soft foods. Eat soft foods such as yogurt, mashed potatoes, cottage cheese, soup, scrambled eggs, fish, cooked fruits and vegetables, beans and grains. In addition, cut foods into small pieces to decrease the amount of chewing required. Avoid hard and crunchy foods, like hard rolls, pretzels, raw carrots, chewy foods, like caramels and taffy, and thick and large foods that require your mouth to open wide to fit. Take medications. To relieve muscle pain and swelling, try nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin or ibuprofen, Advil, Motrin, Aleve, which can be bought over the counter. Your dentist can prescribe higher doses of these or other NSAIDs or other drugs for pain, such as narcotic pain relievers. Muscle relaxants, especially for people who grind or clench their teeth, can help relax tight jaw muscles. Anti-anxiety medications can help relieve stress that is sometimes thought to aggravate TMD. Antidepressants, when used in low doses, can also help reduce or control pain. Muscle relaxants, anti-anxiety drugs and antidepressants are available by prescription only. Undergo corrective dental treatments. Replace missing teeth. Use crowns, bridges or braces to balance the biting surfaces of your teeth or to correct a bite problem. Avoid extreme jaw movements. Keep yawning and chewing, especially gum or ice, to a minimum and avoid extreme jaw movements such as yelling or singing. Don't rest your chin on your hand or hold the telephone between your shoulder and ear. Practice good posture to reduce neck and facial pain. Keep your teeth slightly apart as often as you can to relieve pressure on the jaw. To control clenching or grinding during the day, Place your tongue between your teeth. Learning relaxation techniques to help control muscle tension in the jaw. Ask your dentist about the need for physical therapy or massage. Consider stress reduction therapy, including biofeedback. More controversial treatments. When the basic treatments listed above prove unsuccessful, your dentist may suggest one or more of the following: transcutaneous electrical nerve stimulation, TENS. This therapy uses low-level electrical currents to provide pain relief by relaxing the jaw joint and facial muscles. This treatment can be done at the dentist's office or at home. I have tried this myself and it seems to work okay, but it kind of irritated me. Ultrasound. Ultrasound treatment is deep heat that is applied to the TMJ to relieve soreness or improve mobility. Trigger point injections. Pain medication or anesthesia is injected into tender facial muscles called trigger points to relieve pain. Radio wave therapy. Radio waves create a low-level electrical stimulation to the joint, which increases blood flow. The patient experiences relief of pain in the joint. Surgery should only be considered after all other treatment options have been tried and you are still experiencing severe, persistent pain. Because surgery is irreversible, it is wise to get a second or even third opinion from other dentists. Sorry I got real deep into the subject, but I always try explain everything the best I can. I hope I have answered all of your questions. Please don't hesitate to ask me if you have any more questions. Thank you, Pam Russell RN.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.